Hello, I am Dr. Chatterjee. I am a Senior Consultant Orthopaedic Surgeon with Apollo Group of Hospitals, presently working in Kakinada, Andhra Pradesh, India. Today, we will be discussing about a case of radial head comminuted fracture. As you all understand, comminuted fracture means a fracture where the bone pieces are multiple small pieces. Generally, there are three types of possible treatments in such fractures. Either they are fixed by means of wires, plates, or the radial head is removed if it cannot be fixed, or the third option is to put a prosthesis for radial head with cement. The best result in my view is when a fracture is properly fixed and patient regains the movement. This particular case, a young patient who is around 24 years sustained a fracture in his right proximal femur and also right radial head. You can just see the X-ray. This X-ray is showing that there are multiple pieces and it's a comminuted fracture of proximal radius or radial head area. He was operated with a T-locking plate, and it's a titanium plate, and locking plate with screws fixation was done. I have also used some wires to fix the small fragments where screw fixation was difficult or not possible. The patient recovered well, the wounds healed well after the surgery, and this particular X-ray which I am showing to you now is patient's post-operative X-ray after about 4.5-5 months of surgery. You can see that the bones are nicely united, and I am also putting a small video of the patient. You can see the surgical scar also, that the patient has regained full range of movement. Patient does not have any pain. He is very happy with the result. So I just want to conclude by saying that if properly fixed, the radial head fractures, even if they are comminuted fractures, the results are extremely good and patient can regain full range of movement and go back to pre-trauma range of activity. However, I must mention here that this is just a educational video. You please consult your orthopedic surgeon if you sustain a fracture. For every fracture, the treatment modality may not be the same. And let your orthopedic surgeon decide what is the best fracture management or fracture treatment for you. Thank you.